Hello guys, welcome back. This is I Will Teach You Medicine, and now we are discussing about glaucoma. This is an introduction topic, and this is gonna be a small topic, the introduction part, because it only has like 3 pages of my notes. So now let's start. So this glaucoma series will have this introduction, then the pharmacological aspect of the glaucoma, anti-glaucoma drugs, and then congenital glaucoma, developmental glaucoma, and then we will see further discuss about primary opal angle and then angle closure glaucomas and all the aspects about it. So let's start with introduction. So glaucoma, what is glaucoma? Glaucoma is a disorders which is a disorders, all right, is a group of disorders characterized by the progressive optic neuropathy, because in this glaucoma there is always going to be an optic neuropathy that is progressive, which will result, it will resulting in a characteristic appearance of the optic disc and a specific pattern of irreversible visual field defect. So if you have any idea that glaucoma, if you have studied once in a lecture, or like you have previously known, the main cause of the visual field deficit in the glaucoma is due to the optic disc. It is injury to the optic disc. So we have the definition of the glaucoma as the group of disorders characterized by a progressive optic neuropathy resulting in the characteristic appearance of the optic disc and a specific pattern of irreversible visual field defect in the optic disc. The cop to disc ratio, that's going to alter. All right, we will discuss more in the coming videos. So for the diagnosis of the glaucoma, criteria, let's say three criteria has to be fulfilled. All right, so in the so the intraocular pressure, so in glaucoma the intraocular pressure increases. So if the intraocular pressure is should be greater than 21 millimeter of mercury to be a glaucoma, that's the first criteria. And the second criteria is there should be a visual field deficit. There should be a visual field deficit. It should cause visual field deficit. If the person has IOP greater than 21 millimeter of mercury, and then he does not have a visual field defect, then that's not a glaucoma. So let's read further. What are the limits, visual field? So in the eye, if there is superior visual field is less than 60 degree, and in the nasal side 60 degree, and inferior 70 degree, and in the temporal side the visual field is up to 100 degree. So if it is less than any one of them, then it is a glaucoma. So we have to remember. So suppose this is an person. I draw very bad drawings, all right, so please consider it. So this is a very healthy person, all right. This is a, okay, I should redraw that. Okay, this is a nose. This is a very happy guy, all right. Okay, so not, let's not any kind of waste time. So in the superior part, superior 60 degree up to 60 degrees, this person should see visual field defect, all right. If he does not, if he sees less than 60 degree in the superior visual field, this range, it should be less, it should be if it is less than 60 degree, or in the nasal side, this side, if there is also less than 60 degree, and in the inferior 70 degree, and in the temporal it should be 100 degrees. So if it is less than any one of these criteria, then it is also a glaucoma, visual field defect. So the first was intraocular pressure being greater than the 21 millimeter of mercury, and then the visual field deficit limits, and then there should be optic disc changes. So now let's see any so these are the three criteria for the diagnosis. So let's see some cases, all right. So for let's take this case number one. If a patient has an intraocular pressure of 55 millimeter of mercury, and there is no visual field defect and no optic disc changes, so it is not a glaucoma but just ocular hypertension. So it does not fulfill the criteria. It only fulfilled the criteria of greater than 21 millimeter of mercury pressure of the intraocular intra inside the eye, and then visual field defect was not seen, and then mm, defect was not seen, and no any changes in the optic disc. So it is all just ocular hypertension. So another case is a patient has an intraocular pressure of 15 millimeter of mercury, optic disc is damaged, and visual field is damaged, let's say, then it is glaucoma. but it is normal tensive glaucoma, so there should be at least the tension is not more, but it has led to cause the visual field defect and optic changes, so it can be termed as a normal tensile glaucoma, that is also known as the low tension glaucoma. So for this criteria, these three criteria, at least two out of three criteria must be fulfilled for the diagnosis of glaucoma. So this is very important to give a diagnosis. So let's discuss the types of glaucoma. It is congenital glaucoma or developmental glaucoma, and primary and secondary glaucoma. So congenital glaucoma and developmental glaucoma are primary congenital or developmental, primarily congenital or developmental glaucoma. And the another is primary adult glaucoma. So that can be defined, that can be subdivided into primary POAG, primary open angle glaucoma, primary angle closure glaucoma, PACG, and then normal tensile glaucoma, like we have discussed up above. And then comes we discussed about congenital or development, and then primary. So now it comes secondary. So secondary glaucoma includes many different kind of glaucomas, but some examples are lens induced glaucoma, pigmentary glaucoma, neovascular glaucoma, and steroid induced glaucoma. We will make eventually discuss about it. So pathogenesis, what causes the glaucoma? Pathogenesis. So progressive optic neuropathy is caused due to the death of the retinal ganglionic cell, that is RGC. So for a glaucoma, the pressure that increases, intraocular pressure, that will eventually cause the harm in the optic disc. And in the optic disc, which cells are hampered? That is the retinal ganglionic cell, that is RGC. This is a very important MCQ point. So there are two theories, all right, that it includes mechanical hypothesis and the vascular hypothesis. That's the pathophysiology of the pathogenesis of the glaucoma. So what does the mechanical hypothesis says? Mechanical hypothesis says that the mechanical compression to the retinal ganglionic cell, that is the RGC, due to the raised intraocular pressure, reduce the axonal transport trophic factors. So if the transport, there is something called sorry, let's I will try to make it more clear. There is in the retinal ganglionic cells, there is a factor that is known as the transport trophic factor, all right, transport trophic factors. So in the eye, so if there is intraocular pressure is high, then this optic nerve, you know your optic nerve and the optic disc here, it will press it. So it will lead to affect the retinal ganglionic cell, and that will reduce the axonal transport trophic factors, AATF, for your convenience. So that includes the brain derived neurotrophic factor. So so it will cause the hamper, increase in the pressure will cause the hamper in the axonal trophic transport trophic factor. So what is the exactly the role of trophic factors? How, if how like any kind of what is the relation, intraocular pressure has increased and it has hampered the transport trophic factors. So what happens? So they found out that these trophic factors are essential for the retinal ganglionic cell survival and are transported from the retinal ganglionic cell to the cell bodies of the neuron. So for the survival of the RGC, that is retinal ganglionic cell, they found out that the trophic factor, transport trophic factors of the axon, that includes brain derived neurotrophic factors, are essential for their survival. So in short, intraocular pressure increases, compression of the retinal ganglionic cell axon occurs, due to which there is a trophic insufficiency, and that will lead to the RCC death, that will lead to the glaucoma. This is the mechanical hypothesis. Now let's move on to the vascular hypothesis. So what does vascular hypothesis say exactly? That says the vascular hypothesis says that the failure of autoregulatory mechanism of the blood flow, autoregulatory, we have studies in CVS, there is regulatory mechanism of the blood flow. So if that fails, or any kind of condition in which the vasospasm occurs, or due to the systemic hypotension, you getting me, systemic hypertension will also lead to the failure of the vascular hypothesis. It comes under the vascular hypothesis. So and other causes that are acute blood loss and abnormal coagulation profile. So this all is related to the vascular mechanism, that arteries and then blood flow, all that. So due to the vascular failure of the vascular perfusion, blood is required. So if I all these condition, there is the failure of the vascular perfusion to the optic nerve head in absence of raised intraocular pressure, so that will lead to the glaucomatous damage. So this is the pathogenesis of the glaucoma. So in here we discussed it about the a definition of the glaucoma and the diagnosis and the criteria. So at least out of the intraocular pressure greater than 21 of millimeter of Hg, and the visual field defect that is 60, 60, 70 and 100 from superior nasal inferior to temporal, and if there is any less than that degree, then it is falls under the visual field defect and the optic disc changes. And also we discussed about the normal tensive glaucoma and ocular hypertension, and we discussed the type of the like glaucoma and its pathogenesis. So mechanical hypothesis states that due to the injury of the retinal ganglionic cell, there is the trophic factors, transport trophic factors will get reduced, and due to its insufficiency, it will cause the retinal ganglionic cells death, and that will lead to the glaucoma. That is the mechanical hypothesis. Whereas in the vascular hypothesis, failure of any kind of auto-regulatory mechanism of the blood flow, spasm, systemic hypertension and blood loss or abnormal coagulation profile will lead to the failure of the vascular perfusion to the optic nerve head, and that will lead to the glaucomatous damage. So yeah, I think it's the introduction is limited to this only. We will study about the congenital glaucoma in the next video. So thank you for watching this video, and consider subscribing. Bye.